The Carter family is about to get a whole lot bigger. Beyonce announcing yesterday that she's pregnant with twins. So this morning we're talking all about what the Queen will face while she's pregnant with the next generation of music royalty. All right, say what you want about them, but the Carters know how to make an announcement, right? Yesterday, Beyonce shocked her millions of fans with an Instagram post announcing that she is pregnant with twins. She posted a picture of herself cradling her stomach, wearing just a bra and a veil and undies. This will be babies 2 and 3 for the music power couple who already have a 5-year-old daughter, Blue Ivy. So having twins, it's no small deal. There are certain risks that comes with births of multiples, and that's why this morning we're turning to Dr. Andrea Reh from Shady Grove Fertility. Thanks so much for coming in.
Thank you for having me.
And we went to Shady Grove because a lot of times when people do fertility, they have multiples. We don't know if Beyonce used IVF or not. You know, a lot of people are asking that question. But, you know, it is interesting to me. Why is it that people are so afraid to say they used IVF if they did?
Well, I think that there used to be a stigma with infertility, but I think fortunately in recent years we know that infertility is actually very common, and we spend our whole life almost trying not to get pregnant, and now we realize for many women, especially women in their mid to late 30s, that getting pregnant can be very challenging. And so as more women are able to conceive with fertility treatment and IVF, actually now I think there's a lot more people that are coming out and providing a lot of support to those patients.
And look, the outcome's the same. You have this beautiful baby at the end of the day, right?
Absolutely.
So let's talk about, though, just whether you use IVF or whether obviously people have twins naturally all the time, the risk that comes with having twins.
Certainly. So certainly our goal as a practice is to always have women get pregnant with just one at a time. That's certainly always going to be the safest for the mom and safest for the baby, and that's our goal. But that being said, there is a higher risk of twins with some fertility treatments. There's medications that can have a woman release more than one egg at a time, and that poses an increased risk for twins. And certainly with IVF, if more than one embryo is transferred, then there's a higher risk for twins as well.
But how is the care different? Like, does Beyonce need to do things differently than someone who's just pregnant with one?
Well, certainly that'll be a conversation for her and her doctor. But in general, for women that are pregnant with twins, a lot of it will depend on their pre-existing health and what kind of health they had before they got pregnant. In general, most twin pregnancies do well, but there is a higher risk that the woman may go into labor earlier. And the earlier she goes into labor, that can be certainly more risky for the babies as well.
So now you may or may not know a lot about this, but she's the headliner for Coachella, which is basically like the biggest music festival out there these days, and she's supposed to perform for like a couple days in a row, right? And a lot of people are going based on seeing her. So the big question is, you know, should she perform? Should she not perform? What's going to happen? And now let me just say, Dr. Reh is not Beyonce's doctor, okay? So I know that she's not saying what Beyonce should do, but in your opinion, what do you need to kind of think about in those terms for her?
Well, I think, again, as you said, so this will be certainly a conversation for her to have with her obstetrician, and some twin pregnancies will be also managed together with a high-risk obstetrician or a maternal fetal medicine specialist. But in general, for women in pregnancy, whether they can pursue exercise, which is essentially what this would be, will depend on what kind of shape they were in beforehand. So if you weren't in very good shape before pregnancy, once you're pregnant, especially with twins, is not the time to take up a big exercise regimen.
Yeah, right.
Now, if you're Beyonce, who's obviously in a little bit better shape than probably the rest of us, then, I mean, certainly I think she would be able to, you know, have that, you know, cardiovascular ability to handle that. But again, there certainly are risks in pregnancy. Women would need to make sure they're well hydrated, that they really take care of themselves and in general are not pushing themselves to the same limits that they did before.
Now, when people are pregnant with twins, do they usually go full term or no?
There's a higher risk that they will deliver earlier on average. And a lot
like how much earlier? Like if 40 weeks is normal?
40 weeks is normal. So a lot of twins, in general, the doctors will not allow them to go that long. They'll usually be delivered by about 38 weeks, so only about 2 weeks earlier.
Because, you know, people are trying to figure out when she's going to have these twins. You know, that's why I'm asking all these very important questions, Dr. Reh.
Exactly. So, I mean, there's a higher risk that they can go into labor even before that. And that's really where the concern lies. But a lot of times the doctors will deliver them just a few weeks earlier.
Right. Bottom line is every pregnancy is its own adventure. Absolutely. So talk to your own personal doctor. Thank you so much.
You're welcome.
Really
Thanks
much
for having
appreciate
me.
you coming in and sharing your expertise.